Hi guys, today I wanted to discuss with you common risks and complications following breast augmentation surgery. As you know, every surgery has some risks, including this one. The main things that we need to think about are the complications that can happen in relation to surgery itself, but also issues that can happen with the breast implants. So the common things are common, and these things are common to all surgery that we do: infection and bleeding, and having to go back to theatre to fix infection or bleeding. Luckily, these are very rare complications in our setting, much less than 1% of the time. Because we're putting an implant in, it's really important to avoid an infection of the implant, because it doesn't have a blood supply, and so antibiotics sometimes are not very helpful managing infection of the implant, and often implant needs to be removed. So it's critical to avoid the infection of the implant. Like every other surgery, there can be scarring issues, there can be symmetry issues, and it's important for us to work out preoperatively whether there's already an existing breast asymmetry and we need to correct it, because often implants can enhance and increase that asymmetry if it is already there and it's not accounted for by the implants during surgery. Now, implants themselves have a number of inherent potential complications, problems that can happen. The most common ones are, of course, rupture of the implants and capsular contracture. This is the scarring around the implants. These two account for the majority of the problems that we see with the implants over the 10 years or so. Other common things are, of course, malposition, so implants either dropping downwards or going sideways and becoming really loose in the pockets. Rippling is possible depending on the position of the implant and how much cover there is over the implant as well. Animation is the other one, where the implants can move when you're flexing your pectoralis muscle over the top of them. That one is fairly rare, but again, something to be aware of. There are also serious but really rare complications, and the one that you need to know about is called BIACL. This means that this is a breast implant associated anaplastic large cell lymphoma. It's a mouthful. It sounds scary, as it should be, but it is an extremely rare type of lymphoma, not a breast cancer, but a lymphoma, which means it's a blood cancer, which can be found in association with some types of implants. For instance, I have mentor implants here, which are textured, and this texturing is thought to be associated with about a risk of 1 in 15 to 1 in 30,000 of this condition. Now, to put things into perspective, breast cancer is 1 in 8. Non-Hodgkin's lymphoma, which is another really common, the most common type of blood cancer, is 1 in 50. So 1 in 15,000 to 1 in 30,000 is indeed extremely rare. However, it's something that you need to be aware of and understand why we're choosing those implants in this setting. If we do everything right and plan revisions in a timely manner, we should be able to avoid most of these problems and account for any inconsistencies at the beginning of the operation. I hope this helps.